Hello, you're watching The Big Story with me, Chiao Suen. Subscribe to the Straits Times channel to stay up to date with our live news updates. Deputy Prime Minister Lawrence Wong wrapping up Parliament's two-day debate on the White Paper on Singapore's COVID-19 response. In his closing remarks, DPM Wong lays out some ways the country put up a successful defence, especially taking into account the amount of spending that Singapore incurred. He says, and I quote, "We mounted a strong response." Mr. Wong, who's also Finance Minister, says the government budgeted more than $100 billion, and we eventually spent $72.3 billion over the financial years 2020 and 2021, equivalent to about 16% of our FY 2020 GDP.
In terms of lives, as at 31st December 2022, our mortality rate for COVID-19 was around 300 deaths per million. In terms of livelihoods, our economy recovered quickly to pre-COVID levels by 2021. Our employment rates today are even higher than pre-COVID. And there are many countries like the US, UK, Japan, and Germany which put out much larger fiscal packages. So for the amount of public funds spent, we achieved relatively good outcomes compared to other countries. There were other achievements. I've highlighted mortality rates, economy, but there were other achievements that were not so easily quantifiable, but no less important. For example, we kept schools physically open and education going for our students. We minimized disruptions to in-person learning, particularly for younger students, and mitigated the potential loss in learning outcomes due to the switch to home-based learning. We kept businesses afloat and local unemployment rates low through the job support scheme and other financing support. This helped to preserve firm capabilities and allowed businesses to bounce back quickly when the worst of the crisis was over. And through the SG United Jobs and Skills package, we also helped those who were in between jobs transit to growth sectors, and fresh graduates maintain their skills and human capital while waiting for the economy to pick up. And we kept supply chains open throughout the crisis and continued to service the world as a transshipment hub for air and sea cargo. Even at the height of the pandemic, when many countries, including Singapore, were short of supplies, we never imposed export controls. So on the whole, when you look at all of these outcomes and what we had spent, on the whole, compared to other countries, we've achieved good value for the monies we spent, to stave off the most severe downsides of COVID-19 and to mitigate long-term economic and social scarring.
Meanwhile, Health Minister Ong Ye Kung identified 6 areas of improvement to better prepare Singapore for the next health crisis. Firstly, strengthening hospital capacity. Transitional care facilities, or TCFs, will continue to operate. These facilities were set up to alleviate the stress that hospitals faced during the pandemic and are for medically stable patients from public hospitals waiting for long-term care arrangements like at nursing homes.
During the pandemic, we set up 500 TCF beds across 5 sites operated by 5 private sector healthcare providers. And the TCFs have proven to be very useful. They are very well utilized, and it is as good as adding 500 more beds to our acute hospitals. We have therefore decided that TCFs will become a medium or even long-term feature of our healthcare system. We will retain the current facilities, including continuing to use Changi Expo Hall 9 primarily as a TCF.
Secondly, boosting Singapore's pandemic preparedness and response through initiatives like the Programme for Research in Epidemic Preparedness and Response. Thirdly, restructuring the Health Ministry to institutionalize both individual-centric measures like isolating and quarantining and population-based approaches like mask wearing to deal with crisis. And so, the new Communicable Diseases Agency will be set up under MOH.
This new agency will consolidate the relevant public health functions that today reside in MOH, NCID, as well as the Health Promotion Board. The NPHL, the laboratory, is a critical national resource and will be transferred to the CDA. The CDA will maintain oversight of the clinical facilities in NCID. In addition, MOH will separately retain a permanent crisis strategy and operations group in the ministry. We call it CSOG or CSOC. CSOC was established during the pandemic and grew steadily as the pandemic progressed. It is the machinery behind all the pandemic-related operations that we are familiar with: contact tracing, home quarantine, conveyancing to isolation facilities, testing, vaccinations, home recovery. The operations have scaled down greatly. Nevertheless, we will keep a permanent CSOC force to maintain surge readiness for a mid-sized outbreak, as well as other health emergencies. And this includes preparing healthcare institutions to be crisis ready. In peacetime, when there's no emergency, they help us operationalize Healthier SG. As the skill sets turn out to be fairly similar.
Fourth, updating laws like the Infectious Diseases Act and the Covid-19 Temporary Measures Act, which will both be reviewed and potentially amended. Plus, a new disease outbreak framework will replace the current DOSCON color coding. It will be more intuitive in telling the public that there's an outbreak, threat, or emergency.
Baseline, which is a peacetime state. Second tier, outbreak management, where a pathogen of concern is detected, and measures may need to be implemented urgently to manage disease outbreaks. And these include contact tracing and quarantine, testing, border controls, and masking. And these will buy us time to understand the characteristics of the pathogens, the 6 characteristics I mentioned. Third tier is public health threat, where more stringent, widespread, and longer-term control measures and restrictions are needed. These include various SMMs and restrictions up to and including a circuit breaker-like imposition. And then finally, the highest tier, public health emergency, where very stringent measures such as curfews or requisition of public health assets and manpower may be effected. When these changes come into effect, we can also use these 4 situational tiers to replace the current DOSCON color coding. I think it is more intuitive to tell the public that there is an outbreak, a threat, or an emergency, as opposed to colors. And the law spells out what measures could take place under each situational state. Will this therefore prevent panic buying that we saw during COVID-19 when we changed DOSCON to yellow and orange? Some are already shaking your head. Indeed, not on its own. You just change color to descriptors. There's no reason why panic will just disappear. Whether a people panic during a crisis depends a lot on the information they are getting and whether they know what to do to protect themselves and then contribute towards societal resilience.
And the final 2 areas of improvement: securing vaccines and medical supplies and recognizing the power of crisis. Singapore is expecting that 25% of its COVID vaccine doses will expire in the next few months due to deliberate over-procurement when the vaccines became available. Despite this, Mr. Ong says the expiry of unused vaccines was the price the country had to pay to stave off the risk of catastrophic consequences. Here, he elaborates on Singapore's vaccine strategy moving forward.
First, MOH will maintain and periodically refresh an adequate stock of COVID-19 vaccines to allow continued protection of the elderly and vulnerable as needed, and to facilitate a rapid response should there be a major or more severe pandemic wave. Second, we will maintain a network of vaccination centers, primary care clinics, polyclinics, and a baseline footprint of 5 to 10 joint testing and vaccination centers, even during DOSCON Green. Third, we are negotiating agreements to secure early access to vaccines against other pathogens with pandemic potential. These might include new influenza and other respiratory viruses. Fourth, we will invest in vaccine research and development like the PREPARE program I spoke about earlier. One of our objectives is to establish how to quickly develop a working vaccine based on either the mRNA or protein subunit platform and bring it to clinical trials locally. Fifth, through the EDB's effort, we will be anchoring 6 vaccine manufacturing plants in Singapore. Finally, we will continue to do our part to strengthen global health security and support fair and equitable access to vaccines. There is now a global effort to develop a safe, effective vaccines within 100 days of a public health emergency of international concern being declared. And MOH, we are actively contributing to that effort.
Trade and Industry Minister Gan Kim Yong, who's another co-chair of the now disbanded Covid-19 task force, speaking about the challenges Singapore faced during the pandemic and how those were overcome. For instance, when the issue of when and how to safely reopen borders, which was disrupted amid border restrictions overseas and here. Despite the multiple adjustments to plans due to new variants and Covid-19 waves overseas, Mr. Gan says Singapore managed to reopen its borders and remains on track to recover to pre-pandemic levels.
Today, we have fully opened our borders. Passenger traffic through Changi Airport is expected to recover to pre-Covid-19 levels by 2024. And we are also making good progress on our long-term infrastructure projects such as the Changi T5 and Tuas Port. Ms. Polisan raised the need to support our aviation companies and workers as they continue on the road to recovery. Since the start of the pandemic, the government has provided close to $2.5 billion of support towards the aviation sector's recovery. With the continued support of our industry partners and workers, I'm confident that our status as a hub will grow from strength to strength.
One sector that was hit hard was tourism, which received a boost from the government during the pandemic. Mr. Gan speaks about how providers in the sector managed to keep themselves operational thanks to government schemes and the resumption of international travel.
Although the tourism sector was hard hit by the pandemic, the efforts of the AFA and other industry partners helped the sector bounce back quickly from the pandemic when international traveling resumed. Notably, we also brought back the Formula One night race in 2022, which attracted more than 300,000 participants, and this was the largest turnout since we first hosted the race in 2008. As earlier mentioned by Ms. Janet Ang, another scheme that gave the sector a boost during the COVID-19 pandemic was a Singapore Rediscover voucher scheme. More than 450 hotels, attractions, and tour providers benefited from this SRV scheme. Many of these merchants seized the opportunity to adapt their products for the domestic market and boosted their revenues amidst this challenging period. I'm sure many members and your residents have enjoyed the SRV.
The Heartland Enterprises, retail and F&B sectors also suffered during the pandemic because of the safe management measures imposed on businesses. Mr. Gan explains how businesses were forced to adapt and adopt new solutions to remain relevant amid the changes.
I'm glad that despite these disruptions, many of our businesses showed resilience amidst that adversity. Many Heartland enterprises accelerated their digitalization efforts as their physical storefronts and workplaces were closed. This helped them overcome the constraints of the SMMs and grow their businesses. To date, I'm happy to say that around 93% of our Heartland enterprises have adopted e-payment solutions, which is almost 40% more than before the pandemic. Over 2/3 now have online presence, about 30% more. I'm glad to hear from Mr. Sean Huang and other members in this House about how digitalization has benefited Heartland enterprises in your constituencies. We should thank the business advisors from the Heartland Enterprise Centre Singapore and the digital ambassadors from IMDA's SG Digital Office for their hard work. Together, they conducted over 66,000 ground engagements with Heartland enterprises on e-payment and online presence solutions under the Heartland Go Digital program.
From economic and security ties to a shared history and kinship, President HALIMAH Yaakob believes that there is much scope for Singapore and Malaysia to expand relations, bringing benefits to both sides. Madam HALIMAH, who is in Malaysia on a 3-day state visit, also says bilateral ties between the neighbours have grown from strength to strength since diplomatic relations were established 58 years ago. Her first state visit to Malaysia reciprocates one made by Malaysia's King, Sultan Abdullah Ahmad Shah, to Singapore last October. She received a state welcome ceremony at the Istana Negara and then planted a glam tree in the palace courtyard with the King, a ceremony usually accorded to the rulers of each state in Malaysia. An orchid was also named in Madam HALIMAH and her husband's honour, called the Vanda HALIMAH Yaakob Muhammad. From Singapore to London to New York, recruiters across the world are getting an unprecedented flood of calls from Credit Suisse bank employees seeking new jobs. It comes as the embattled Swiss lender is set to be taken over by rival UBS. According to reports, one firm in Singapore handled calls from about 30 mostly Credit Suisse private banking executives on Monday alone, while recruiters in Hong Kong and London have been fielding calls linked to the two banks all weekend. Thailand will hold an election on May 14th. The country's election commission announced this just a day after parliament was dissolved. Rallies have been already underway for months, but parties are stepping up their campaigning in a contest shaping up to be a battle between a pro-military conservative grouping led by the incumbent Prime Minister against the largest opposition, Pheu Thai Party. And those are our top stories for today. Visit straitstimes.com for more news and our YouTube channel for more videos. Subscribe by hitting the red button below. I'm Chao Suen and I'll see you tomorrow on The Big Story.